Good morning, my name is Trach Cunningham and today's date is September 9th and the time is 12 o'clock p.m. Today I'm going to be performing trach suctioning and trach care on my patient. I've already explained the procedure to my patient and we've already established modes of communication during the procedure. He's going to lift his left hand up if he's experiencing any pain or any abnormal feeling. He's going to lift that left hand up. I've already assessed my patient's respiratory rate, his depth, his breathing, and his heart rate, and also the pulse oxy. I've checked his oxygen saturation. So I have my patient. He's sitting up in semi-Fowler's position. I have a towel over him just in case, we make a mess. We won't make a mess on my patient. We'll have, the towel is there to help with the mess. I'm going to perform hand hygiene and patient privacy. I've already brought the bed up to my working height. And I'm also going to turn my suction on from 180 to 120. So the suction is on. Alright. So now I'm going to begin with my trach suction. So I have my table over here. And I'm going to begin by opening it. And then I'm going to get my sterile gloves out. Okay. Alright, so now I'm going to put on my sterile gloves. And I did notice that my gloves rolled. In the hospital setting, I would definitely just discard these gloves and apply some new ones. So now I'm going to throw that away. And I'm going to keep my hands above waist level so I do not break sterility. So I have my tube and I have my normal saline. I'm just going to discard that. Put that right there. I'm going to take my tube out. So now that I have my tube out, I am going to connect it to the suction port itself. I am also going to, before I connect it, I'm going to connect it first. Now that I have this connected, this hand is now contaminated. I'm going to take the oxygen off because I hyperoxygenate my patient. I'm going to have him take 3 to 4 deep breaths. When she's done, and then I want to just take that off. So now that I have that, I'm going to now test the suctioning by putting it in this normal saline, and it does work. So now that I have that, I'm going to insert the suction tube into the trach, and I'm going to keep inserting it until I meet some resistance. And I did, and as I meet resistance, I'm now going to intermittent suction, and I'm going to gently pull out, and as I'm pulling out, I'm going to turn the tube as I pull out. And I'm going to do this as many times as the patient needs me to do it. In this case, we're going to do one. But if you do suction more than once, you want to give the patient like 30 to 1 minute breaks in between each suction. So now that I have that suction, I'm going to document any the secretions, the amount, and then I'm going to reassess my patient's respiratory depth, rate, breathing pattern, oxygen level, and we're hoping that all of that has improved now that we cleared the secretions. So now that I have that, I'm going to disconnect this from the suctioning, and I'm going to also take off this gauze part, and then I'm going to just take off my gloves and throw away all these items. So that is how you suction a trach. Now we're going to move on to cleaning the trach itself. So I'm going to bring this over here, and I'm going to open up my tracheostomy care tray. I'm going to move it over here so you guys can see. And I'm going to start by putting on gloves, but I'm going to perform hand hygiene as well. I'm sorry. So now that I've done that, I'm going to open up my sterile gloves. Only touching 1-inch borders around it. Ready? So I did see some rolling of my glove in a hospital setting. I would re-glove and discarded these. So throw that away. And I'm going to keep my hands above my waist so I do not break sterility. And we want the shiny side facing down. So now that I have this down, I'm now able to go inside my kit. Got my normal saline, hydrogen peroxide, my 4x4s, some Q-tips, my cleaning brush, and the new Trach collar. So now that I have that, I am going to pour the normal saline into 2 compartments. And I'm going to throw this away. Then with my hydrogen peroxide, I'm going to pour that into 1 compartment. And I'm going to throw it away. And so now that I have all my 3 compartments filled, I'm going to put my 4x4s into the normal saline. I'm going to let that soak. So now I'm going to go over here with my non-dominant hand. I'm going to take out the obturator gently. Then I'm going to place it into the hydrogen peroxide. Let it sit. And then with my dominant hand, I'm going to take it out. Well, with my dominant hand, I'm going to pick up the brush. And then with my non-dominant hand, I'm going to take it out of the hydrogen peroxide. And I'm going to turn to the side, and I'm going to clean it. And the reason I'm turning to the side is because when I'm cleaning it, I don't want the secretions to get all over my sterile film. So now that I have it cleaned, I'm going to discard of this. And I'm going to put this into the normal saline and clean it off. And so now with my dominant hand, I'm going to take it out of the normal saline. And I'm going to reinsert it back inside. So now that I have that back reinserted, I'm going to come in here and get my gauze that's been soaking in the normal saline. And I'm going to gently clean around the site. Then I'm going to discard. And I'm going to do that however many times I need to get my site clean. So now that I have cleaned the site, I am going to put a clean gauze back under the trach. Only using my dominant hand. Then if I need to with my Q-tips, I'm going to just make sure it's on there right without hurting my patient. And I'm going to throw this away. So now that I have the trach site all cleaned up, I am going to take off these gloves, perform hand hygiene, and I'm going to put on some clean gloves. These are really small gloves. And now with my clean gloves on, sorry, these are really small gloves. So now with my clean gloves on, I'm going to take off the trach collar, and I'm just going to take off one side at a time. And I'm going to put my clean new collar on because this collar was soiled with secretions. So gently try not to hurt my patient as I do this. That part. Then I'm going to lift my patient's head and I'm going to undo this part a little. Take out that part. Alright. Sometimes it can be a little hard to put this in, but the main concern is just trying not to hurt the patient as I'm doing it. And then I'm going to gently secure them. After I secure them, I want to make sure that it's not tight enough, so I'm going to make sure I can put 2 of my fingers inside the collar. It's a little tight. It's going to loosen it up some more. I'm going to make sure my patient is okay. As I said earlier, I'm going to document any secretions that I cleaned up, the amount. I'll make sure my patient is okay and comfortable. Make sure the call light is within reach. And I will document my findings and document how well the patient took the procedure. Thank you.